My name is Austin McMyer. I'm the spine surgeon here at South Texas Bone and Joint. So my subspecialty is adult spine surgery, so I specialize in the cervical, thoracic, and lumbar spine. So originally what kind of pushed me into choosing it was the patients themselves. So throughout my training, I really saw how much pain spine patients can be in. So it really pushed me into the field to try to help in any way I can. I started kind of my schooling journey in medical school in Fort Worth. So it was at a school called Texas College of Osteopathic Medicine. After that, you go to something called residency, which is really 5 years of specialty training to become a surgeon. That was at UTMB in Galveston, Texas. And then finally, which I feel is the most important, is fellowship, which was done at Geisinger in Pennsylvania, where you get kind of a exposure to your subspecialty, in particular, in my case, spine, where you really learn the most innovative, modern techniques that you can apply moving forward. I think, having a fellowship-trained orthopedic spine surgeon really gets, for the residents, it gives exposure to the most innovative and modern techniques available in spine surgery today. I think that is of great benefit for the people in this community. One of the things that makes me the most passionate about treating patients in particular is really working with the individual patient to come up with a treatment plan. There's really no one size fits all for everybody, and whether that be a non-operative or an operative treatment plan, for me, coming together with that patient and finding the appropriate plan for them is really what I feel passionate about. So patients can expect when they come to see me in my office is a comprehensive exam of their spine. Again, each patient requires a different approach, and ultimately I put the patient in the driver's seat as far as that plan goes. So we have a conversation and make a diagnosis and offer a breadth of treatment options for that patient. So what made me choose South Texas Bone and Joint is really the quality of the physicians here. Many of them were known to me from my training in Galveston. Originally, my program director, which is in charge of kind of the training program, reached out to South Texas Bone and Joint and connected us. After I came down and met all the physicians and really saw that the quality of care they offered this community, kind of knew it was the right fit for me. If I can tell my patients really one thing about back or neck surgery is that for the right reasons, it can be a very effective surgery. Every patient is different and has a different problem, and it doesn't always require operative intervention. But when it does, and it's done for the right reasons, it can be very effective to relieving patients' pain.